Hello, I'm Annick Gloria, a student in healthcare management. So today I'm working on final project in quality improvement module. So before answering for the four questions related to the quality improvement work that I've been given, so I have to give a little overview of the meaning of healthcare quality improvement. So when we talk about or when we say quality, quality is all about like doing the right things from the first time and every time. So we say it is improvement when it's just to make things better. And we say that its method is about a series of steps. So in quality improvement, there are three things that have to be included. There is product improvement, there is process improvement, and there is what people-based improvement. So before or to continue, I may say that what we call PDVA, which is the demanding cycle, is a model of a logical sequence of a repetitive step of continuous quality improvement and learning, of course. So the P stands for plan, the D stands for do, the V the A stand for study, and the A stand for the act, of course. So for the P, we plan actually. First, it's about like we plan ahead for change and analyze and predict the result. So we do is about like do is about uh, execute the plan, thus taking small step into control circumstance. Then study is about check or study the result, and then when you say act is a way to take action to standardize or to improve the process. So going to answer for the four questions, I'm going to answer from the first one: how does the status of healthcare quality look like in developing country settings? So in my view, or what I saw, is that in developing countries, the quality of healthcare is still low or is still poor compared to the developed country due to the limited skills, knowledge, and poor education. So people are given care services quality, and they don't know where to report their cases. For instance, like in a given healthcare facilities, it's very hard like to find the suggestion box where like a patient can put their suggestion about the services and the services that they got there. And you can find sometimes those people who use as mutual descent. It's an example in Rwanda. People who use the mutual descent, they are not allowed to the given services, and a lot of the fact that maybe they are poor or they cannot afford the money to pay those services. So healthcare is not affordable by everyone. So, and also it's in developing countries say that healthcare is the quality improvement is underdeveloped, it's fragile, or it is vulnerable quality. So going to the second question, what are the different risks that patients are experiencing due to the lack of the quality of care? First is the medication administration errors. There is also death, because sometimes when there is no care, and when the healthcare providers have to deal with you and they don't get time, or there is that lack of experiences, so that may lead to death easily. And again, illness complication. For instance, let's say that you are coming from a given hospital and they didn't treat you well because they don't have any experiences, and instead of like being healing, now the illness become complicated, and that's the illness complication. There's poor medical diagnosis, there is increase of mortality rate. As I said, that there will be death, of course. There will be the increase of mortality rate. There will be like preventable death. It will be hard to prevent the death, and there will be inadequate of poor health related decisions. So we may see that there's different risks that the patient are facing due to the lack of quality of care. Okay. Oh, okay. According to the report that was written by American institution, they say that patients with chronic diseases such as like hypertension, diabetes, cancer, and hepatitis, so do not receive the proven, or I mean, an effective treatment such as those with drugs or self-management services to help them to get like an effective or to have like a good condition due to the lack of coordination of care for patients or those chronic diseases. So going to the next, so what are the priority areas that need much emphasis in terms of quality improvement? So as indicated by the National Academic Press, the priority areas that need like much emphasis in terms of quality improvement are those below. First, there is cancer screening that is evidence-based, is focused on colorectal and cervical cancer. So it means that there must be an increase the number of individuals who are offered appropriate screening for cancer, like colorectal and cervical cancer, and to ensure that the timely follow-up is provided. There is also stroke, early intervention and rehabilitation. There's tobacco dependence treatment in adults. So is that there is if there is like a high emphasis in avoiding tobacco, people will get like to know how tobacco causes various respiratory diseases such as lungs cancer and others, and they will be able to know how to avoid smoking so as to maintain their health in good condition. There is what we call obesity. As I, like in these days, people you may find that there are much people who are big or have obesity due to the lack of healthy nutrition, due to they do not do like sport activities. So and this increased obesity. This pregnancy and childbirth is about appropriate prenatal and intrapartum care. So this sometimes you have like to help young girls in high school to know more about this so that they can prevent pregnancy and childbirth. And again, it's about children with special healthcare needs. There's diabetes, we get higher focus on appropriate management of early diseases. There's what we call asthma. So it's about appropriate treatment for persons with mid or moderate persistent asthma. There's hypertension, there's a screening and treatment of major depression, there's medication management through preventing medications error and the overuse of antibiotics. Going to the next questions, which is so it's about, we're going to talk about what are the different interventions that stakeholder of healthcare industry should take into consideration for remediation. So stakeholder should be like involved during each stage of program to build support for it. We gotta provide like suggestion for its design and participate in evaluation and continuously quality improvement activities. So here stakeholders have to include like senior Medicaid and agents leaderships, the governor's office, the guide community, the patient and advocacy community, the state legislature, and the centers of Medicaid and Medicaid services. It means like CMS. So the directors of healthcare facilities should like provide trainings to all their staff members so as to equip them with the skills they need and about health and provide quality care to their patient, of course. And again, they need to partner with a successful organization, because those, if a given organization gets successfully, so they will be able to get financial support as they need, of course, to invest in healthcare sector. And again, is that healthcare professionals have to collaborate with the government, of course, as I've been saying before, because it's about like the governor's office. So they have to collaborate with the governor, just in case they could be like able to set different policies or rules that could help the healthcare providers or the healthcare institution to give a higher quality service delivery. So that was all about the healthcare quality or improvement project I was working on. So thank you very much for your attention.